Good morning. An estimated 10,000 baby boomers turn 65 every day. That has dramatic effects on Medicare. What is the best approach to put Medicare on a permanently secure financial footing?
Putting Medicare on a firm financial footing is going to, first of all, involve repealing Obamacare. Look, let's take a look at what Obamacare does to Medicare. First thing it does is it cuts $700 billion out of Medicare. It's pretty hard to say you're in favor of Medicare and cut $700 billion out of it. But let's take a look at the second thing it does, which is even worse. It creates a 15-person IPAB board that will effectively be the people deciding who gets medical treatment and who doesn't. This is rationing. This is government rationing. Now, if you want Medicare to work properly, what we need to do is to get away from the concept that the government has to do everything, solve everything. Because in Medicare right now, the government sets the prices of the cost of everything in medicine. But we don't want the government setting prices. What, in fact, I think we should do is to allow a series of different people to offer medical care to seniors and let them choose which one they want. It's a whole lot better to choose between different providers than to have the choice of only the federal government. And so I think we need to get rid of the price setting, which never works. You can go back to 1600 in England. It never works. The government shouldn't be price setting. Just allow providers to offer the service to seniors so they have choices. Thank you.
Senator McCaskill.
The Affordable Health Care Act, known as Obamacare, does not cut one dime in Medicare benefits. Not one dime. It realizes savings by taking some of the big profits away from the insurance companies, the corporate welfare that they were making off Medicare Advantage. It lowers some of the reimbursements to hospitals because it depends on the fact we're going to have more paying customers. But it doesn't cut a dime of Medicare benefits. And by the way, once again, it's the same $700 billion that he voted for in the Ryan plan a couple of times. It closes the donut hole, and it extends the solvency of Medicare for 8 years. Now, what I didn't hear in Congressman Aiken's answer was his plan. His plan is to privatize Medicare. He wants to give seniors a voucher, and once you spend your voucher, you're on your own. You're on your own. If the premiums go up, you can't afford it, you're on your own. If medicine goes up, you can't afford it, you're on your own. Now, how do we fix it? There's a couple of things we've got to do. One, we need to do some more aggressive means testing. I know it's political season, I'm not supposed to say that we're going to do anything like that, but I believe in it. I don't think we can afford to buy Donald Trump's prescription drugs. He can buy his own. We're doing that now. We can means test some of the Medicare programs and enact some of the savings programs that are working. St. John's Hospital in Springfield, on a pilot program, took their Medicare population, and with quality control and customer satisfaction, they were able to reduce, through managing the care more carefully, $17 million in Medicare payments that were owed. As a result, they got a bonus of $4 million. That's incentivizing. That's what we need to do in a capitalistic system, is incentivizing prevention and spending less money rather than incentivizing more treatment.
Jonathan Dine.
Like many of the government entitlement programs, Medicare, Medicaid, are all coming to a cusp. They're coming towards a financial cliff where we're not going to be able to save them if we don't make some drastic cuts now. I would propose block granting the states money based on population to deliver health care for seniors and people over 55. I feel that the states would be more close to the people of the state, actually more apt to listen to the legislators and provide you with a better service for your dollars. I think that anytime you expect the government to manage your money efficiently, we can just look at the record of spending money recklessly with mismanagement. I feel that we really need to make some tough choices or we will all be left with nothing.
Congressman Aiken, Senator McCaskill have characterized your position as privatizing Medicare and giving seniors vouchers. Would you like to respond to that in your rebuttal time?
Sure. The idea is that the senior has a choice in medicine. That's the idea. Instead of having one size fits all, which is the big government solution. We're trying to allow choices. Look, there's one thing in medicine that I don't like, and that's when an insurance company gets between the doctor and the patient. But there's one thing worse, and that's when the federal government gets between the doctor and the patient. And I don't support, and neither did 71% of the Missouri public support, the bright idea of having the efficiency of the federal government and the compassion of the IRS running our health care. I'm opposed to that. I voted 30 times to repeal it, and when I get to the Senate, I'll be the one that votes to make sure it gets repealed totally.
Dr. Casper, would you like your additional 45 seconds there?
Well, I think it's important to remember that there is a lot of misinformation about this bill. There's not a government plan in it. It's all private insurance, and there's good things in it. And you need to remember what Congressman Aiken wants to repeal. He wants to repeal the ability of insurance companies to say you're out of luck because you've had the nerve to be sick before. He wants to repeal kids being able to stay on their policies until they're 26 years old. He wants to repeal a focus on free prevention so we can avoid serious health care costs down the line. He wants to repeal the insurance companies having some rules of the road and having to refund your premiums if they decide to spend most of their money on more people to deny your claims rather than on your health care. I think if Missourians will give this legislation a chance, they're going to be pleasantly surprised.
What current issue in federal government do you feel least prepared to address as a U.S. Senator, and how might you better prepare yourself to deal with it?
And I'm first?
You are, yes.
Well, I hope I am prepared, since I have been blessed to serve at the state of Missouri for 6 years. But I think the thing that prepares me the most, day in and day out, is my focus on being here in Missouri and traveling Missouri. When most senators were avoiding town halls because the debate had gotten intense and sometimes vitriolic, I was out there doing town halls on the health care bill. I've done so many tours around the state on veterans benefits, on agriculture, on manufacturing. What really prepares me best for my work is staying in constant contact with the people, because that's what this is about. It's not about me and a fancy job or a big title. It's about Missourians and who's protecting them and the programs that matter to them. Who's looking out after them and making sure that we do reduce spending and get rid of wasteful earmarks. One of the reasons I knew we had to work on veterans benefits was because I spent time out in the veterans community. One of the reasons I understood we had to get rid of earmarks is I actually heard from Missourians about how unfair it was that congressmen were supplanting their judgment for local planning on highway projects. That is what prepares me most to do my job. It's working with and listening to the people of the state that I love.
Jonathan Dine?
I'm not a career politician. I'm just a regular, ordinary American like many of you, and I'm concerned with the direction that the country's heading in. Our career politicians don't seem to be serious about actually addressing the problems facing our nation. They're more concerned with getting reelected than facing the controversial issues. The thing that prepares me for this job is just being from the ground level. I understand I have an open mind and will listen to the people of the state. So when I vote on bills or propose legislation, I'll represent the people of Missouri and not a party or a lobbyist. I think one of the biggest problems with America is the career politician. And I think we need term limits across the board. 2 6-year terms for a senator and 6 2-year terms for a congressman is enough. Congress should be a revolving door of fresh ideas. Too much stagnation and entrenchment in our government has brought us to where we are now.
Todd Aiken.
Look, no matter how much you work and prepare and study, when you're working in Congress, you're going to get issues that you just don't know that much about because there's so much going on. In fact, we run into that all the time. And our job is then to get up to speed on the issue and try to render a good judgment on it. I'll give you an example. The things that are most difficult vote-wise are the ones that you're not quite sure what the answer is when you first hear it. On the Wall Street bailout, all of a sudden we were approached, and Paulson looked like he was about to disintegrate. And he's saying the whole world economy is going to collapse unless you give us $700 billion in unmarked bills in a brown paper bag. But we had to make a decision. He gave us 2 lousy choices. Common sense in Missouri says look for a third solution. And so you have to do some research and study something that you're not sure of. And once you figure out what's going on, in this case we didn't need to buy Goldman Sachs at double book value, you find out that there's basically a principle behind all things. And you have to basically focus on that principle, put the politics aside, and do the right thing for the people of our state, for our families, and for our nation. And if people and party bosses don't like it, that's too bad, because our job is quite simply find the principle, do the right thing, and then you know what? A year or two later, the politics is gone. And somebody asks you, why did you vote no on it? It's because we could have changed accounting rules and fixed the problem without spending $700 billion. Start with the principle, do the right thing.